So we're here today to talk about acupuncture and learn a little bit about how acupuncture works.
Sure.
Can you tell me a little about
How
the
acupuncture
theory
works?
behind acupuncture?
Well, here's an analogy that I usually tell patients that most patients can understand, all right? So how acupuncture works, think of it as, here's just an analogy. Like, if our goal is to turn off the light in this room because it's too bright right now, we don't need the light, there's a couple ways to achieve it to make the room dark, all right? Number one is you can somehow climb up there and take out the light bulbs. That will work for sure, but it's a little bit dangerous. That's kind of like surgery, take out what you don't like, okay? But there's potential risk, you could zap yourself, you know. All right, but there's a much simpler way to do it. You can just turn off the light switch, right? You can just turn the light switch, much easier. It's reversible, it's not dangerous. You can turn the light back on when necessary. So turning off the light switch is kind of like acupuncture, all right? And where the light switch is think of it as the acupressure point. You're manipulating the functions, all right? You see how the light switch is not where the light source is? In fact, it's very far from the light source, very far from the light bulbs, but it's at a very convenient place where you can turn it on and off as you desire. Right? So acupuncture is kind of like putting the needles in where the acupressure is, and you manipulate that point. You can either turn it on, turn it off, you know, depending on what your body needs. And of course, there's a connection between the light switch and the light bulb. That's kind of like the wires inside the wall is there. You don't see it, right? But it has to be there. It's not magical, you know. So that will be kind of like the meridian, the connection, the nerve, the vessels that connects, you know, that's everywhere. There's a whole network system inside your body. You don't see it's underneath the skin, but it's definitely there. That's kind of how your body communicates, right? So that is why sometimes, you know, you would put points in where that's not necessarily where your pain is. All right. But it's because of that connection, all right? So for example, you could have low back pain, but we could put a point in your hand, and that's really effective for pain. But that's because that's where the pain is. Because sometimes it's say if you have back pain, it's really difficult to lie face down, you know, take off your shirts and you know what I mean, and put the points on your lower back. But sometimes it's a lot easier for you to just lay comfortably, you know, on your back, and you can just do a couple points on the hands and the feet, and that's really helpful for back pain.
Well, that is just a fantastic analogy. Thank you.
For more information and to request an appointment, visit gobeyondmedicine.com or call us at 859-586-0111.